This is a summary of the CPIC guideline for beta blockers and variation in the genes CYP2D6, ADRB1, ADRB2, ADRA2C, GRK4 and GRK5. This video will specifically cover the recommendations for metoprolol. A video covering the gene-drug pairs assigned a no recommendation in the guideline can be found on the PharmGKB website and on the PharmGKB YouTube channel. This guideline was published in July 2024. Patients who are CYP2D6 poor metabolizers may have markedly high plasma concentrations of metoprolol. As a result, the guideline recommends beginning therapy at the lowest recommended starting dose before carefully titrating upwards. CYP2D6 poor metabolizer patients should also be closely monitored for bradycardia. Alternatively, another beta blocker can be selected for these patients. There is no recommendation for patients with a CYP2D6 ultra-rapid metabolizer phenotype. This is the PharmGKB metoprolol pathway. A link to the pathway is provided in the description below this video. Metoprolol is inactivated by metabolism by CYP2D6. In CYP2D6 poor metabolizers, the metabolism of metoprolol is reduced. This increases plasma concentrations of metoprolol. There are over 170 different CYP2D6 alleles, which are designated as star alleles. Each star allele can be assigned an activity value based on its activity level compared to the star 1 allele. The star 1 allele has an activity value of 1. This table gives the activity values of some CYP2D6 star alleles. It is based on the CYP2D6 allele functionality table, which can be found on the PharmGKB and CPIC websites. Links are given in the description below this video. It is strongly recommended that you consult the full allele functionality table, as it gives further examples of alleles with their activity values. In addition, the supplementary material for the guideline provides more information on interpreting CYP2D6 genetic test results, as well as limitations and caveats that should be considered. Be aware that some CYP2D6 alleles have an unknown or uncertain functional status and should be interpreted with caution on a genetic test. In addition, an important caveat for all genotyping tests is that any alleles which are not detected in the assay are designated as star 1. This can include rare increased function, decreased function, and no function alleles, which are not routinely screened for in some genotyping tests. It is also important to note that patients can carry multiple copies of CYP2D6. Reports in the scientific literature have described cases where up to 13 copies of CYP2D6 were present in a patient's genome. Alleles which are present in multiple copies on the same chromosome are shown using an X, then the number of copies of that allele that are present on the chromosome. For example, a patient with the genotype star2X3 star4 has 3 copies of the star2 allele and 1 copy of the star4 allele. The activity value of alleles that are present in multiple copies is calculated by multiplying the activity value for the allele by the number of copies present. In this case, the activity value of star2X3 is 1 multiplied by 3, which equals 3. Further information about CYP2D6 alleles can be found at the PharmVar website at www.pharmvar.org. A link to PharmVar is also given in the description below this video. The activity values of a patient's CYP2D6 alleles can be added together to give us total CYP2D6 activity score for the patient. The CYP2D6 activity score is then used to assign a CYP2D6 metabolizer phenotype to the patient. Note that genetic tests from different laboratories may not use this scheme to assign CYP2D6 metabolizer phenotypes. Because of this, the guideline advises that a patient's CYP2D6 diplotype is noted and activity score calculated before making clinical decisions based on this guideline. These are the CPIC recommendations for metoprolol. There is no recommendation for patients with CYP2D6 ultra-rapid metabolizer phenotype. This is due to uncertainty around whether decreased plasma concentrations of metoprolol in these patients leads to any clinically significant changes. Patients with a CYP2D6 normal metabolizer phenotype will have normal metabolism of metoprolol. These patients can begin metoprolol therapy at the standard dose. This is a strong recommendation. Patients with a CYP2D6 intermediate metabolizer phenotype will have reduced metabolism of metoprolol compared to normal metabolizers. However, this does not appear to lead to any clinically significant changes in heart rate, blood pressure, or clinical outcomes. These patients can begin metoprolol therapy at the standard dose. This is a moderate recommendation. Patients with a CYP2D6 poor metabolizer phenotype will have reduced metabolism of metoprolol compared to normal metabolizers, which leads to greater reductions in heart rate and blood pressure. However, it is unclear if this also has an effect on clinical outcomes. These patients can begin therapy at the lowest recommended starting dose. The dose can then be carefully titrated upwards to clinical effect or to a guideline recommended dose. Monitor the patient more closely for bradycardia. Alternatively, another beta blocker can be selected. This is a moderate recommendation. There is no recommendation for patients with a CYP2D6 indeterminate phenotype. The recommendations for metoprolol can be found in Table 2 of the guideline. This guideline has been annotated on the PharmGKB website. This includes a drop-down menu where a specific recommendation can be given for given combinations of alleles. This includes implications for the patient's response to metoprolol and the appropriate recommendation for the specific metabolizer phenotype. Remember that variation in other genes in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.